American businesses and break the American economy. I got great health insurance.
You say you want a revolution. Well, you know, we all want to change the world.
I just have a quick question. Do you support President Obama's 3 principles for healthcare reform? Okay, I have them here. To reduce cost, to guarantee choice, and to ensure quality care for all. Terrific.
Community, because sitting in the primary care unit waiting for hours to see a doctor for an appointment that was 5 hours ago, there are a lot of people sitting in that waiting room who look like they are really on the edge of the edge of existence. And
you go to the orthopedic doctor and she says, well, he probably needs serial casting, but before we ever would do that, you have to have an MRI because we want to make sure it's not, we recommend you have an MRI because we don't want to make sure it's not spinal. He's been to the doctor 85 times. They always check, it's not spinal, but I'm like, oh, absolutely. And next thing I know, insurance doesn't cover it. Surprise, surprise.
I mean, they send you for tests, they have no clue how much it costs.
Or what insurance is going to cover.
And he told me, riding on Pennsdale, that he had been diagnosed with cancer in his jaw, and he didn't know what he was going to do because he had no health insurance. And he only survived because of the generosity of friends.
Yeah.
I feel sorry for the poor older people. Well, and there's this donut, that once you hit the donut, you have to pay completely for
a lot of money.
Now, I don't know, the government is now going to subsidize.
Change jobs, his health insurance expired. During that time, he needed emergency surgery, woke up with $10,000 worth of debt that has left him unable to save or buy a home or make a career change. That's who health reform is about.
And because I'm uninsured, I have artist friends and we talk about it all the time.
Yeah. But why are you uninsured? What's your...
I'm self-employed. Right now I'm self-employed and I was a student for a long time.
And it's too expensive?
Yeah, and I've worked plenty of jobs where they didn't have any benefits or no insurance.
I was going to say you have to work.
Did she graduate May 18th? Okay, she gets 3 months of free health care. And then on August 18th, she has no more health care. Yeah. But you could buy her into your plan if you want.
And it's only
$500 a month.
When I go to the primary care over at the U of C, that waiting room is filled to capacity.
Right.
And I'm lucky if I get in within 2 hours of when my appointment is
scheduled.
Talk
about medical tourism. And so
good.
there are certain...
Do they have a program like that in Tahiti? I've always wanted to go.
Exactly.
I'm going to get my physical therapy in Tahiti.
UFC ran the clinic at 47th Street, which was much more convenient.
And is that the one they just closed?
They closed. And put them in there, and now it's more chaotic at the Decan.
Yeah.
And so,
you talk
and I
to
think they
people who
did it
work
for
over there.
financial reasons, so that they didn't have to pay rent on another building, which...
So part of my hope with the current debate about healthcare is we can begin to realize that if we had a more efficient, affordable system here, then perhaps as a nation we could invest more in providing just the minimal standards, just the minimal basics for zillions and zillions of kids in developing nations around the world.
We all want medical care, but no one wants to pay the taxes. But somehow somebody's got to need to come up with the argument that if you pay the taxes, it's going to offset what you've been paying before.
Right.
We've already determined that about 2/3 of the cost of reform can be paid for by reallocating money that is simply being wasted in federal health care programs.
Well, and like the whole delivery system, pharma could be a lot more efficient because there are organizations that are great at that sort of early compound discovery, and if we sort of left it to them and had all the other big pharmas do more licensing and not all the initial discovery bit, they could be more efficient.
There's a whole issue of generic drugs, and how many pharmaceutical reps have stocked doctors' offices with the real thing.
Oh, they totally.
It's a blatant marketing.
The doctor doesn't even know.
So that's I think that's an interesting thing, is that there are some cultural implications. And I read something yesterday about big differences between Hispanics and whites and African Americans and access to care and diseases and all that. I mean,
We need to, so I think there's an element of empowerment that
Yep.
we need to generate across the broad masses
Mm-hmm.
around, just, you get to say, really, sure, I need an MRI, really, you won't do the serial testing without it, or
Do you support President Obama's 3 principles for healthcare reform? Oh, you do? Okay.
This is the American team right now. Yay! The team of the United States of America that has to